Hello, everybody. This is Will,
And Owen.
and we are on air for your daily podcast. Today, we're going to be discussing the, in my opinion, very well written novel, One Flew Over the Cuckoo's Nest by Kesey.
When it was published in 1962, it was a very different time, where the procedures and medication and the way we perceive patients in mental health wards were much more barbaric. But times are changing, along with the way we see the mentally ill, and we're going to take you along for the ride. This is a little bit of background information on the story. This story is about mental patients in an Oregon mental institute in which the dozens of male patients are mistreated daily and have been force-fed drugs and subjugated to harsh treatments, such as shock therapy and lobotomies. Under the tyrannical control of their nurse, the men seem to have lost all their hope until their unlikely hero is committed to the ward, McMurphy.
I agree, Owen. The men seem to be kind of lost in the sense that they don't really have much freedom to do whatever they want, you're supposed to have. And I feel like those kinds of treatments and therapy don't really help at all with the healing and the mental process.
I would agree.
Alright, so a little bit of background about Ken Kesey. He was influenced to write this novel due to his past experiences in mental institutions. Often when he was writing this story, he was on LSD or some other drug, and therefore the memories of his experiences and kind of the pains that he encountered could have been altered or exaggerated.
I think Ken Kesey's life in and out of mental hospitals really had an effect on the setting of this book. It was set in 1962 Oregon. The physical setting in this ward is somewhat dark and malice, almost prison-like. We see the patients in cramped and inadequately sized rooms. The whole thing almost gives an eerie feeling about the ward, and this also leads the book to have more of a depressing emotional setting due to their conditions.
Absolutely. I would just like to add that maybe even the control that the nurse had over it almost gave us a feeling of helplessness, that we could not really do anything for the patients almost. Alright, now let's talk a little bit about the kind of treatments and procedures that the patients underwent in the ward. At least in the book, during one of Harding and McMurphy's conversations, they talk about the lobotomy and how it's chopping away part of the brain. And Harding also explains it as a kind of frontal lobe castration, because if she can't cut below the belt, she'll have to do it above the eyes. I think that's kind of a gruesome description of what the lobotomy is, but nonetheless, it is a perfect example of what happened back during that time.
There's another example from Harding where he reveals how the patients feel about the shock therapy and how it is. It's said to do the work of the sleeping pill, the electric chair, and the torture rack.
Yeah, that's all together in one. It's a
pretty grimace.
Pretty brutal treatment right there. One more example from the book is that, for example, when Cepho freaks out about his Dilaton, he's worried that the gum rot that it causes will affect his chance to ladies almost.
That's true. Ladies don't want a man with rotted gums.
So, some of the procedures and medications, what would they be like back in this time?
Well, there's one example of Dilaton, which Cepho takes during the book. This is also known as a phenytoin. It belongs to the group of medications known as an anti-epileptic. It is used to manage and prevent certain types of seizures, as well as to prevent and treat seizures that occur during or following neurosurgery. It works on the brain to reduce the number of severity of seizures, but there are also many side effects from this drug. These drugs are known to cause certain side effects, which are also shown in the novel, such as bone pain or fractures, bleeding, tender, or enlarged gums, which is pretty gross, seizures,
Nasty.
and also suicidal thoughts and behavior.
Yeah, there were also many other medications, such as tranquilizers and benzodiazepines, which were used as muscle relaxants, and sedative techniques, which cause side effects such as drowsiness and almost kind of like a zombie zombie-like traits. Also, there were these medications called SSRIs, which were selective serotonin reuptake inhibitors, and they are used as antidepressants to treat major depressive disorder and anxiety disorders. All of these medications kind of fall under the opium, marijuana, and morphine categories, which were all widely available back in the 1960s. Some of the other procedures that the nurses and the staff used back then were group therapy, in which the book, for example, talks about how the nurse was kind of using those group therapies to turn the other patients on McMurphy, and we're almost using it as kind of a control
Form of brainwash propaganda.
Yeah, kind of like a propaganda type thing.
In today's society, there's a more controlled form of psychotherapy. It's one of the more modern approaches to dealing with mental illness is using psychotherapy, which is an interpersonal intervention usually provided by a mental health professional, such as a clinical psychologist.
Yeah, absolutely. And there were also, nowadays, there's brain stimulation treatments, such as electroconvulsive therapy, which was also kind of mentioned in the book. But nowadays, it's much more controlled, much more, they're more careful with it.
They don't give it out as frequently.
Yeah, exactly. They have set schedules on when patients can receive it, and they don't have, they have limits on how many treatments one patient can receive. They also have a different kind of therapy called family therapy, where they get the patient's family and they get the patient's close friends together, and they kind of sit them down, they kind of discuss everything that's been happening in the ward, and it kind of helps them cope with it maybe a little bit better.
We found that nowadays, instead of the harsh treatments that they were receiving in the hospitals, they would receive more group-based therapies. There's more therapeutic group homes and community residences, and
Kind of gives them like a sense of independence almost, right?
yeah, it helps them heal even quicker than before.
Even programs such as community support are valuable sources that patients can go to. So let's talk just a little bit more about how the procedures in the novel went, right?
Yeah, we found that a lot of the procedures in the novel were used as a form of punishment instead of a form of care. This can affect the progress and well-being of patients. Instead of having the idea of rehabilitation and release for the patients, they're being used as a form of entertainment for the workers. An example in the novel, several treatments were used as punishment instead of care.
Yeah, exactly. Like, for example, during one of their group meetings, the nurse stepped in and said, "You men are in this hospital because you've proven the inability to adjust to society. The doctor and I believe that every minute spent in the company of others, with some exceptions, is therapeutic. With every minute spent brooding alone only increases your separation." To a certain extent, I disagree with this statement, because everybody needs some alone time, whether you're mentally unstable or not, just so you can kind of relax and heal from society's pressure, right?
I think it was the extent of the separation now.
Yeah, I agree. But this also tells us as readers that the patients are a part of the ward because they don't meet society's standards, right? And until they can learn to kind of conform to how others want to see them, they're not going to be released. And I think in kind of another sense, using these procedures as punishments sort of drives a wedge between the staff and the patients.
Yeah, it causes them to want to rebel more. You see a lot more disrespect on both sides because of this.
Totally, and I feel like it almost shows that the patients will shy away from the treatments that could actually be therapeutic and could actually help them recover from whatever mental illness they may have.
Kind of like Sefelt, who stopped taking his Dilaton.
Yeah, exactly. So in the novel, we see many points of satire, right? So let's discuss a little bit about that.
Some of the evident examples in the novel are the clear racism and sexuality, and also the objectification of women. We see racism in this novel when people compare the black boys to dogs, and the degradation of Bromden and his people in his flashbacks.
We also see the objectification of women when the patients are making comments about Miss Ratchet's breasts and Harding's wife and how she's
model-like.
Yeah, and how she's sort of seen by the men as kind of like a goddess almost, right?
We also see the repressed sexuality of the patients, such as Billy Bibbit. We see how uncomfortable sexual encounters make him, and it's probably to do with the amount of seclusion he has in the ward and the lack of socialization.
Yeah, totally. I also think that we also see almost an over-sexualization in the character of McMurphy, and how his past experiences when he was just a really young boy may have kind of caused his character to become over-sexualized. Yeah, and another way that the novel shows kind of a satire is that in the racism that the patients use when talking to the black boys and when talking about Bromden, they kind of almost do it as jokes.
Yeah,
so,
it seems like the normal for them.
Yeah, like nothing they say is really wrong about it. Well, anyways, I think we can safely say that at the end of the day, this is a pretty great book.
I would definitely agree.
Well, that's all the time we got, so this has been Will and Owen with your daily podcast.
Ciao.